name's Mitchell Philip McLaughlin. I work at Braemore Lodge, which is a psychiatric residential care working within the Lakes District. So we support level 3 and 4 mental health consumers and high and complex needs. The high and complex needs clients require a lot of one-on-one time with staff.
My name's Donna Mitchell. I'm the registered nurse at Braemore Lodge and I'm also a registered assessor. Probably the most important thing about Careerforce is that we have an opportunity to be able to support staff to develop their career pathways, and that starts from the moment of orientation and induction.
The foundation skills have been an absolute lifesaver in our business. It's given every staff member a good basis as to what's expected from them in the workplace. All the core competencies that are based on Careerforce are all linked directly into our workplace. They work within our work practices and our policies and procedures.
I started with the foundation skills, which really did help with tying into the induction at Braemore. Gave me all the base and core information I needed to be able to do my jobs correctly. Would I recommend the training? I certainly would, even if it's just starting at the foundation skills to find out if you enjoy or you are able to do the work. Definitely, I'd do it.
At Braemore, initially what happens is that staff receive their books, they decide which way they're going to work through them. When they've completed a workbook, they may come back to us, either myself or Mitchell or Trudy, and say that they've got particular issues with a certain area. We'll then bring that up at a staff meeting and see if that's occurring for everybody. If that's occurring across the board, we'll then do a training session for all of the staff to be able to catch up and be on the same level.
So then we use a cotton applicator, only once, applying directly to the wound. Wipe or dab the external area of wound.
So you're near the ear, so it'll be like this, and then you pull the ear up and out, and then the amount of drops that you would put in.
You're going through doing the workbooks, you become quite competent yourself in being able to say, this is going to match with this particular book and this particular book, and you're able to reassure staff that those are some things that they've already met and been able to go through and do. I need you to demonstrate or describe 2 advantages and 2 disadvantages regarding pre-packaged medication. So, you able to just talk to that?
Yeah.
No problem with that? Go for it.
There's actually quite a few advantages, but a couple of main advantages I see is all your medication for the entire week is there. It's there, it's all labelled and the person's name's on it, and it's got the date.
You've gone through this and you've cruised through it. You've clearly got a really good grasp on everything that's going on here. So I've gone through, I've marked the book, I've put in just a few little comments. It's pretty much like that for all of the staff. Workbook's completed, they notify me, we set up a mutual time. I tell them what information they need to bring with them, I take away their workbooks, I mark their workbooks, and then we sit down and go through all of the information that's been gathered. So how did you find it? How did you find the assessment, the workbook?
Workbook was good because I was actually stuck on the rights and responsibilities, and I didn't have too much knowledge on that. So going through pre-packaged meds, where I'm working with meds and that, it gave me actually confidence to get the other books done.
There are huge benefits to having in-house assessors. For starters, it's actually built and established a lot of our policies and procedures, not just to do with employment, but also we've got a huge amount of buy-in from the staff. The staff are now involved in not just doing risk management plans or care support plans, they're integral now in doing parts of policies and procedures. They understand the rationale behind things that are happening, and so now what we have is that instead of being an individual, it's up to them to do all the risk management plans, that's their duty, that's their job, and then staff sign it off because it's compulsory that everybody's read and signed this document. They're now asking questions about why this particular thing are you doing, why is this activity better than other activities. So you've got a huge buy-in that comes from staff. We're quite a crisis-driven service, so what happens is we get very, very busy times when you have 6 staff on during the day and 6 staff aren't enough, but then what do you do with the quiet time and the downtime, and staff are using that to proactively go through and complete their workbooks. And what's happening for me now is that instead of me doing the risk management plans and me doing the support plans, staff are actually stepping up and starting to do those themselves too.
So that real benefit is starting to show.
It is starting to show, yes.
Investing in training is absolutely invaluable for our staff. It keeps all our staff working on the same level. It means we get consistency of care for our clients.
The reality is that 9 unit standards for 1 staff member for less than the price of a first aid certificate is just incredible. And I know that every day staff are going to have to use things that come out of just those even those first 9 unit standards, and then you go up another step to the core competencies, and it's even more every day, every conversation, everything they're having something to do with. It's been really, really good value for money. The Careerforce is invaluable for people that are having to undertake auditing. When we have auditors come through, they always want to know what the evidence is. It's not enough to say that you've got staff that are competent in doing medication. It's not enough to say that you've got somebody who's written an infection control policy or manual or anything else like that. They want evidence of how staff have met that. And now we have this beautiful set of books, qualifications, they're NZQA approved, and you can just hand it over to them and say, well, here's the evidence, that the staff are easily meeting the requirements, and in fact they're surpassing it.
Well, my name's Kat. I've been at Braemore for a number of years. I've been in other residential houses before I came here, and now I'm living here at Braemore. It's this one here.
How you take your medication? How do you know that's yours?
Well, first of all, it's got my name on it.
Okay, yes.
And just like we usually do, Sunday, Saturday, Friday, all that, that's the day.
Yes.
And that one there is our dinner times. It's got dinner. So I just usually take it right about 8 o'clock or something.
Okay,
before because if I don't take my medication at night, I actually find it very hard to sleep.
Mm-hmm.
I found it's given me more confidence. It's I've got more understanding of the service delivery plans and the risk management plans to implement them in the workplace.
Hello, my name's Paul Raymond Cumming. I've been a bit paranoid schizophrenic for about, since I was 21. I'm 51 now, and I've been in Braemore Lodge for about 20 years, been going in and out of mental homes. And
I really think staff at Braemore are really well trained. I have seen situations they have handled, and they do a lovely job. They really know what they're doing, and the clients really love Braemore as well.
We've completely adopted the embedded model for training. We think they've had a huge influence in the way that we run our service, the way we've developed it, and the way we're planning to in the future.
Clients are getting a much better service because the staff are better prepped. They know that each staff member has the same qualifications, they know exactly what to expect from each staff member, and it's equal to a better service.
Careerforce has had a huge impact on our business. We've had staff now that have written policies themselves. They've gone through the books and said, we don't have a policy on, it's a true story, we don't have a policy on security. It doesn't meet the requirements that are in the documentation. And I turned around and said, well, then write one. And they did, and they wrote a perfectly good policy. They presented it at a staff meeting, and we've now adopted that policy in its fullness. So you get a big buy-in from staff, they're all involved, and also what happens is that I think that well-educated, well-trained staff feel more valuable, they feel more confident in what they're doing, and you've got better staff retention. I think it's a win-win all the way. The staff understand why they're doing things, and the clients benefit hugely from it.
Braemore is my home. I love it, and it makes me feel safe. I just feel safe at Braemore.